All right, we have Miss Jessica here, and she was sent to us to get what's called the Webster breech turning technique. A lot of times things can get caught up where the baby can be unable to turn because this area in here, her hip flexors come down and her center of gravity is such that she's like this and the baby physically cannot turn. So we come over here and we feel some points and we feel it's different than the head. You feel that right in there? Yep. And so what we're going to do is, we know that she's got a tender point right there. It's also on the same side as her short leg. She actually, we measure her legs, you measure her ankle bones like that, she's nearly a ½ inch short on the right. So what we're going to do is we'll stop the video a moment and we're actually going to...
You could feel it.
We can feel the head of the baby is right here. Also confirm Jessica is actually in the field of obstetrics as a nurse. And normally they do an inversion technique medically where they go in manually and do it. So we're trying all this good stuff first. We're going to take this percussor. We're going to come right over here on our psoas insertion. And we're just going to release this muscle for a second. It's a little tickly, right? Totally safe on the baby, which sits here. Got a little picture of Connor there, big brother.
All right.
But no, normally we get a good picture. Baby sits in a big fluid of amniotic fluid, and it's completely safe. Her psoas muscle starts up in her diaphragm and attaches to T12, L1, L2, L3, L4, L5, and inserts into the lesser trochanter of her femoral head. So she'll find that these tickle spots tickle, but they also might be a little sore. The reason for that is that tickle fibers and pain fibers run along the same neurological tract. They're called type C, unmyelinated type C fibers. We're going to release